Okay, so I think this is working. Um, I suck at these. Hold on. Why did I decide to work with my site over the summer? I really wanted to work with Crossroads because that was my LPCC. And I realized that it was a population, there was a lot of lower socioeconomic individuals and such that I wanted to work with. I wanted that diversity and I wanted to help that patient population, especially since I thought when I first applied that I was going to be working with Crossroads a lot more as part of my LPCC. So I figured making that network and making that connection was important. Also, because UHP was supposed to have shadowing, but COVID, man, COVID. Let's see, what else? What are my most memorable experiences? I'd have to say one of the biggest ones was the point where I was able to use something that I take for granted a lot. My being bilingual in English and Spanish, I was able to take that ability and actually implement a huge change at Crossroads. And that was very like momentous to me and something I'm going to always remember, especially since Alex and I worked really hard to get this collaboration between the project we were working on in the medical Spanish elective so that there always be Spanish speaking volunteers at Crossroads handling the social determinants of health project so that the Latino population, or I guess out here in Ohio they call it Hispanic population, can actually get resources that everyone else, all the English speakers, were getting, and historically this population was not getting these resources. So it was very more memorable, and it was a lot of work because we translated over 1,000 resources, and that took hours of work. So it was hard, but it's really gratifying, even more so since I've been assigned to that volunteer track as part of the medical Spanish elective, so I can keep watching over it and seeing how it progresses in the future, which is really exciting to me. And let's see, biggest takeaways from the experience. For me, one of the biggest takeaways is that a lot of patients don't know how much a clinic can do for you, and just stuff that clinics can do, like just having a volunteer program like social determinant health. They get funding from the government and they help patients because a lot of them, I'd call them up and be like, yeah, we're offering this for free. Is there anything you really need? And they're like, oh yeah, my living conditions suck and I need to move. I just don't know how or where or what can I do to afford it. And it was really empowering to see being able to give patients resources that they need for things and being like, no, it's okay. Here's everything you need. You don't have to do any footwork. Things are stressful enough as is. That being able to provide that extra level of care to a patient, especially those who have so much other stuff to worry about, especially with times of COVID. That was very memorable and a big takeaway for me. Definitely in the future, I wanna, if I don't end up in Cincinnati and I end up somewhere else, if the clinic or hospital I'm working at doesn't have something like that, I would definitely want to bring a program similar to what we see. How will this impact how you practice medicine in the future? I think I'm actually going to screen for social determinants of health just right there and then. I know it's going to take a little more time and people are going to complain maybe. I mean, 15 minutes is all I'm going to get with patients, right? But I feel like it's so important, especially for the patients who will be there oh yeah, I'm fine, I'm doing great. See, hey, how are you with food? How are you with interpersonal violence, transportation? I was very shocked to see that interpersonal violence was such a huge factor in patients' lives nowadays, especially in Cincinnati and the population we were treating. And then it was also really interesting to see that providers, certain providers had a heavier load of patients who had SDOH needs versus other providers did. And so maybe in the future, do set up screenings for that so that we can when new patients come in, especially with zip codes that we identify be super needy, spread out the work a little more so that one provider doesn't have 100 patients who all have health problems plus social determinant health. Be everyone gets a little bit, and then this way the providers will have a more manageable coursework. And being a provider heading that, it might actually be easier to get that implemented versus a volunteer program being hey, we want to do this with y'all. And did I have any issues or difficulties with this? Nope. this site was great. I'm excited to continue working with them, even though it's not through UHP, it's through the medical Spanish elective, but I'm super stoked for this entire project to continue and like train the next generation and hopefully keep this going for years to come. So yeah, thank you to the both of you. And I'm so sorry I'm turning this in so late, but I wear my hat. All right. Cheers. I think that's 2 minutes. How do I end this?